Good morning, everyone. I'm Adair County Judge Executive Gail Cowan, and we're coming to you live on Facebook this morning to give you an update on the COVID-19 cases here in Adair County. I'm joined with Adair County Emergency Management Director Mike Keltner, Executive Director of the Lake Cumberland District Health Department Shawn Crabtree, and we have Mayor Hoots over here. She's not visible on the screen, trying to keep our social distancing. So this is one update that we were really hoping we wouldn't have to give, but we are here to announce we do have one positive case in our local nursing home here at Summit Manor. So I'm going to go ahead and just turn it over to Mr. Crabtree and let him go ahead and give us an update.
Thank you, Judge. Yesterday evening, we were notified of a positive case at Summit Manor. I immediately let the judge know what was going on, and I advised her not to do a press release until this morning. So if anyone's upset about that, it was on my advice. My logic was I wanted to give the staff, my staff who were going in and doing the investigation and giving advice, and to give the nursing home staff time to respond before they started getting inundated with folks who were worried about their family. So just kind of the same logic why the emergency response doesn't call the media when they're responding to a car crash. They want to be able to get there and do their work before everyone starts showing up. So I hope everyone will be understanding with that. We did dispatch our staff immediately to the site to begin an investigation of the circumstances and to give recommendations. I do have a statement here from Signature Healthcare. That's the corporate owner of Summit Manor, and I would like to read what they have written. I think maybe they might have some more information later today, but this is what we have right now. This was from their corporate office in Louisville. Over the past several weeks, Signature Healthcare at Summit Manor has taken a proactive and aggressive approach against the coronavirus and its related illness, COVID-19. The preparedness mandated being ready not for if, but when our facility faces a confirmed COVID-19 exposure. Signature Healthcare at Summit Manor has received confirmation of its first case of COVID-19. We've been working around the clock getting ready for COVID-19, and we're ready now that the day is here, said Chris Cox, Chief Operating Officer for Signature Healthcare. This is why we hired the experts we have on our team, including a new chief infectious disease physician. Our intense preparations have paid off, especially in this situation, with staff screening themselves and residents daily, and staff readily identifying anyone who might have the virus early and getting them sent out and tested right away. Signature wants to assure our residents, families, and stakeholders that we're taking every precaution possible and are following the strict guidelines of the CDC and other controlling government agencies, which include screening all stakeholders and residents daily for symptoms of the virus, restricting facility visitation in accordance with federal and state guidelines, and using alternate methods of communication for families, including telehealth, social media, and the mailing of cards and letters. In this COVID-19 climate, we must continue to mandate per government instruction that our families continue in this restricted protocol. It is of the utmost importance for the protection of your loved ones. Signature is grateful for families' patience in minimizing contact with their loved ones to help prevent the spread of the virus, and for their understanding and knowing that all healthcare providers are facing this crisis. No one is insulated, said E. Joseph Steyer. I hope I pronounced his name right. The third, President and CEO. Signature sincerely appreciates all of the tireless work and commitment of its community and the best stakeholders who serve some of the most vulnerable residents anywhere 24/7. We are beyond grateful to have a collaborative team ready to serve during the most challenging time ever for Signature. If you have any further questions, please contact Ann Bowden Wilder, Media PR Communications Manager at abowdanwilder@signaturehealthcarellc.com. And we might make that address more available to people than me just reading it off. We did dispatch a team to the nursing home immediately, and I got this update from my director of nursing this morning. She said, this is my director of nursing, Laura Woodrum. LCDHD, the Lake Cumberland District Health Department, has spoken with the director of nurses at Summit Manor regarding the positive COVID-19 case. We've provided them the following guidance. self-isolate the patients immediately, which they did. Roommates were to be separated and self-isolated. So the person who was exposed had 2 roommates. The person that's the positive case is in a single occupancy room, and the other 2 roommates have been moved into a self-occupancy room for precaution. They've been, in other words, quarantined. We've isolated the positive case and quarantined the 2 close contacts. We've guided them on proper cleaning procedures and instructed a high-frequency schedule. We have provided for them the CDC long-term guidance for positive residents, the CDC healthcare guidance for exposure of healthcare workers. We've assured assured that there have been no activities. Residents have been in their rooms. We also consulted with the Lake Cumberland District Health Department Medical Director, Dr. Christine Wayman, and she gave them the following instructions: that workers should wear masks while working. Surgical masks is preferable. If they exhaust their resources and can't get more, they can use fabric masks and launder daily. Now, why would we recommend they wear a mask? We're not recommending that the workers wear N95 masks. We're recommending they wear surgical masks. The way that this virus works, younger people or younger workers, you can have the virus and you may be asymptomatic, not have any symptoms, or you may have such mild symptoms you don't even know you have it. And if you have it and don't know you have it, and you go into your place to work, which you're required to do, you can transmit it to the patients who are a much more vulnerable population. So the purpose of wearing the surgical mask is to protect the patients from the staff bringing it in. The staff have to come in and out of the facility. I mean, that's just the way this is. So it's a difficult situation, but instructed them to use the surgical mask. We've asked them to monitor any cough, short of air for all residents and staff, and instructed they take temperatures on every employee before they enter, and residents 2 times a day. In case that they start showing early fever symptoms, we want to get them tested quickly and respond appropriately. The Lake Cumberland District Health Department is working with Summit Manor to conduct recommended case investigations for the residents and the employees. In other words, we're getting in touch with all the close contacts and assessing at what risk they are and making proper recommendations. I know just this morning the judge and I and the emergency manager and I and my staff have already been talking about measures that we can take with other long-term care facilities and personal care home facilities in our district. We're putting plans in place even as we speak to have my staff at the health department. I don't know if we will dispatch them or just try to reach out to them through conference call or Zoom meeting or something. We don't want too many people going in and out of these lockdown facilities, but just to make sure that they do have prevention plans in place, that they are executing them, and that they also have a plan in place for when they have their first case so they can respond very quickly. And we need, as counties, we need to start thinking about what happens if we end up not having enough occupancy rooms, if it spreads farther and we have overflow. What are we going to do with that? So that's just early in development, but we will, as counties, we will get right on that and figure that out as quickly as possible. So that's all I have for the moment. Judge, I'll turn it back over to you.
Yes, everyone, just anyone tuning in a little bit on their live feed, if you missed it, we do want to report that our 3rd positive case is related to signature.
Okay, everyone, we had a little technical difficulty there. We'll try to just pick up and roll right along with live. Anytime we deal with internet and things of the sort, we could have issues. So sorry for that. This will be the 2nd part of our announcement. Just to recap a bit, the 3rd positive case in Adair County of COVID-19. Let me just cover this. Signature Healthcare at Summit Manor has received confirmation of its first COVID-19 positive case. This is coming from the press release that was issued from Summit Manor late last night. So continuing from the video that we started a minute ago, I just want to say from emergency management, we've been working with them for weeks, but going back for months on our ties with Summit Manor and trying to work with them on everything from planning and exercises that we've been working with up there. I do want to say that they were as part of our strategic national stockpile supplies that were issued out 2 weeks ago. I don't have the exact numbers. They've received quite a bit of personal protective equipment to go and help with the residents and the staff up there. As this comes on, and we talk to Director Crabtree about some things that will be coming up, and we're going to have, continue to work with them as much as we can. I do want to say that please continue to remember our Adair County frontline people, the ones that are out there working, and we are all part of Team Kentucky. It is going to take some different approach from us, I believe, on this, and this is something we definitely didn't want to have happen. And as far as I know, this might be one of the first in the state. Not really sure on that in that long-term care facility. So I don't have the exact on that. We'll get maybe a little bit more, but this is a different time, and I'll say, I have a family member up there, and Judge Cowan has family there also. So this is presents a little bit of an issue. We know that this is our people that probably at most risk. So I know the steps that they're taking at Signature and Summit will definitely be good for us. So.
Well, we've got an audience. Let me reinforce, as I always do, the importance of social distancing. Avoiding crowds. If you need to go out to the store to get something, get there, get back out. Don't linger. If you have to be out, stay 6 feet away from each other. Make sure you're washing your hands regularly and correctly, lathering up after you've wetted your hands 30 or 45 seconds, wash the front and back of your hands, between your fingers, under your fingernails. Most people don't wash their hands nearly sufficiently enough to kill bacteria and viruses. So wash your hands frequently. Avoid touching your face so you don't transmit the virus that way. Make sure you're sanitizing your home, and if you're shopping, the handle of the cart and all that stuff just as much as you can. If you feel sick, stay home. We've had situations in our district where people have gone to work symptomatic and exposed people for several days while they were symptomatic. And they did just the opposite of what we hope people would do, creating a much more difficult time for the public health response when those kinds of things happen. Don't forget to use our website, Lake Cumberland District Health Department. Click the COVID-19 banner and it'll take you to all sorts of additional resources. This was some numbers I put together yesterday to kind of give you all an idea of what we have to expect. The state growth rate of this virus is at a factor of 1.21. Now, if you don't know what how to translate that, it means that it's doubling. The number of known cases is doubling about once every 3.64 days. At that growth rate, right now we know of, when I did this, we had 26 cases. I think we're up to 29 or 30 now. But when I did this at 26, tomorrow, at that growth rate, 31.46 in a day, 38.4 by the end of the week, 98.73. This is district-wide. By the end of 2 weeks, 375 cases. We want to beat those trends. We want to do better than that. And the only way we're going to do better than that is if we social distance and if we slow this thing down. That growth rate is pretty consistent nationwide, statewide, and locally, and we would like to slow that down. I gave this example the other day. In our Lake Cumberland district, we had just over 200,000 people. So I'm going to use 200,000. That's a nice even number. If only 1% of those people disobey the rules and get out and social mingle, that's 2,000 people. And if 1% of those 2,000 people get this, that's 20 people. And how much of an impact can 20 people who've got this make? Well, on day one, they would be 20. On day two, 24.2. By the end of the first week, 75.95. By the end of 2 weeks, 288 people would be impacted because 1% of the 1% caught this. Right now, the U.S. mortality rate on this is 2.23, or at the mortality rate. Let me say this: of those 288 people that would be impacted, we have a 19.1% of our population is in the 65 plus range. That's our elderly, it's our high risk group. So if 19.1% of those 288 people was in that high-risk group, that would be 55 people. And at the U.S. mortality rate of 2.33 for all groups, that would be one of them dying. But now the mortality rate is much higher for that high-risk group. It's up to 30%. So in all likelihood, it would be significantly more of that group of elderly people, high-risk people, that would end up getting this statistically if we're not doing the things that we need to do. So the next 2 weeks, as the governor says, is extremely critical that we do the things that we're supposed to do. Lake Cumberland, Adair County, we want to come in better than these projections. So let's all do our part. I know yesterday when I was announcing the first death in Pulaski County, I talked about all the people that was wanting to cast stones at the church for not counseling services. Well, how many of us that's wanting to cast stones are really doing what we're supposed to do? Before you start fussing at someone else, look at yourself, and are you really obeying the rules? Because just a few people not doing what they're supposed to do, it can grow that fast. So, Judge, I'll turn it back over to you.
Mayor, do you want to say anything?
No, just, I want to reiterate what he said. That's what we say, that everybody's responsible, all responsible. Stay your social distance. Stay at home, if at all possible, stay at home.
If you can't hear the judges or the mayor is saying, make sure you do the things I said, stay home, social distance, avoid crowds. She's trying to reinforce that message. That is the important message. Thank you, Mayor. Do you guys have any questions?
Are any of the Adair County cases related?
Are any of the Adair County cases related? I don't know that I can answer that off the top of my head. If you want to ask another question, I can try to look that up for you.
I don't have any others. Are any of the staff at Summit Manor being self-isolated?
Are any of the residents?
No, any of the staff.
I don't know yet. The investigation happened last night, and I got a summary this morning of the things that happened. I've not been told yet the details of every single person that's going to be isolated or quarantined. So I just can't answer that. We're early enough into this. I don't have that information. I'm going to try to look up for you here. My computer will come on if any of those are related.
We'll be reaching out to them to get more details, and hopefully they'll have more information later today.
I do want to say while we have an audience, we're going to take every step that we can. And I believe the judge, I know the judge is behind. We've talked about this, and we're going to do everything we can for our citizens and to protect our at-risk people there at Summit. So everybody remember all the ones that are out there working and keeping on this front line. And it takes your actions to help this and stop this. So please remember to stop the spread of this, what we have to do.
My file is opening now, so.
Like I told somebody the other day, we can do everything in our power, but we need to be doing on the front lines and getting people notified and all that. But if people don't do what's recommended of them, it's almost like a slap in the face to our healthcare workers and our EMS people. So
How is the patient? Is the patient showing?
She's not in the hospital, so that means she's not in the hospital. So she's still well enough to be isolated at the facility. Of course, they're a skilled facility, but at some point, if they get sick enough, they'll be transferred to the hospital. So the fact that she hasn't been transferred to the hospital yet tells me she's doing at least pretty good. The question about were any of these cases related, none of the Adair cases were related to each other or any other case in our district. So these were all new cases. At this point, the whole world considers this to be community spread, which means, we've given up on trying to find index cases where it originates from. We just know it's all around and you're going to get it from somewhere. So, trying to figure out who case zero is something that has been abandoned. I mean, maybe we can figure out who case zero was in China someday, but as far as the rest of this, it's spreading so quickly. You don't know if you're getting it from the person at the grocery store or from a family member who comes to visit you or whatever. It's just impossible to track that down. But we do know that these 3 cases, they weren't connected, and they weren't connected to any other case in our district. So.
Anyone watching this live, please know that we had a technical issue. It stopped us about midstream of the last video, so we had to restart that. So please go back and look at the first part of the video for the signature health statement. And if anyone didn't get that as far as media, we'll make sure we get that to them as soon as this is over.
Any other questions?
Have one more. Just for clarification, are all patients at Summit now in individual rooms and self-quarantine?
I don't think so, no, just the ones that are,
Roommates?
yeah, that's close contacts, the actual case and close contacts of the case. With the staff being instructed to take temperatures daily, low temperature is one of the early signs. So, they're trying to be proactive to monitor to see if they have anyone else that looks like they may be getting it. They would, of course, want to do testing pretty quick and try to deal with that as fast as they could. When you're dealing with a confined space, a lot of people, it's a challenge. So whether it's in a jail, whether it's in a personal care home, nursing home, whatever, when you get into a confined space, it gets tough. They're doing the best they can, I would say.
And I'm not 100% sure on this, but I think the patients up there, they haven't been allowed to go like to the dining room, things like that for several weeks. They've been staying in their rooms, but some of them have 2 or 3 patients per room. So there's no other questions. I think that's about all we have. We just ask everybody to, just keep all our cases in your prayers, them and their family and our entire community and our state and nation. So that's my opinion is the best thing that's going to get us through this. So that's all we have.
Thank you, Judge.
And we will be updating, as we get more information, we will keep everybody updated this weekend.
If anyone needs a copy of the press release,